40-year-old female, severe abdomen injuries. Book me an OR.
Hey, how's it going?
Oh, hey, nothing much. Did you hear about Mr. Xavier's case?
I'm not too sure, but I really want to get into the OR and start suturing. I've been practicing on my banana.
But I heard the resident wasn't really that great. Mr. Maroon is apparently really...
Put the banana away. We aren't suturing today. The first shift starts now and lasts 36 hours. You're grunts, you're nobodies at the bottom of the surgical food chain. You run labs, write orders, work every second night until you drop and you don't complain. We got rounds. Let's go, people. Follow me. How are you feeling today, John?
Oh, you know, the usual. Oh, I see you have 2 new interns.
Hi there. Hi.
Keep busy, eh?
Not busy enough. Izzy, explain the prognosis.
So we have John Xavier, age 40, diagnosed with end-stage renal disease. Symptoms include fatigue, headaches, loss of appetite, and nausea.
What test do we have to run, Christina?
We can do blood tests, or we can do other tests such as sodium, potassium, and we can check for phosphorus and albumin.
There is more. I don't know how you got into this residency program. What else do we have to test for?
Cholesterol, magnesium, complete blood count, and electrolytes.
Course of treatment?
There are 2 possible treatments, which is a transplant and a peritoneal dialysis. And in this case, we're going to go with the peritoneal dialysis.
Thank you, interns. Mr. Xavier, I'll send these interns in an hour to explain the treatment.
Thank you, doctor. I see you still treat the interns the same.
Yeah. Hurry, that's rule number 2. You're supposed to follow me. If I'm walking fast, you better keep up. I'm going to show you something you guys are going to enjoy. So the kidney functions to filter waste and excess fluids from the blood, which are then excreted through the urine. Chronic kidney disease is usually triggered by long-term diseases such as blood pressure and diabetes, which, as seen in our patient, slowly degrade the kidney and reduce their function over time. You don't have to put your hand up.
Oh, I just assumed with all of the rules that I would have to. But I just wanted to add that patients with chronic kidney disease, they're measured based off of different stages, and this is based off of their GFR. And what I learned through school was that people with greater than 90 milliliters per minute have healthy kidneys, and if you're less than 15, if you have stage 5, my apology, it would be less than 15 milliliters per minute, and that's what we see in Mr. Xavier.
Christina, what is GFR?
GFR is the calculation of how well the blood is filtered by the kidney, which is one way to measure the function of the kidney.
And what stage is our patient in?
In stage 5, which is end-stage renal disease.
Seems you have an idea of what's going on. I'm going to show you the 2 kidneys.
Okay.
So Izzy, since you wanted to touch the kidney so bad, how about you tell me what the functions are?
Let me just grab my gloves. Okay, so this is the healthy kidney, and you have the aorta and the inferior vena cava, and what you can tell is this is a healthy kidney based off of its size, and it should be the size of a fist. And now I'm going to look at a non-functional kidney, and as you can see, it is significantly smaller, and this is like our patient, Mr. Xavier. But to see the full effects of end-stage renal disease, you'd have to look into it in the histology.
Hi there, Mr. Xavier. We're here to discuss your course of treatments with you. So we've actually had some discussions with Dr. Maroon, and we've decided to go with peritoneal dialysis.
Oh, that sounds good.
Okay, great.
So I'm just going to explain what the process is like. So in the process of peritoneal dialysis, the inside lining of your belly, so do you see this over here? It will act as a natural filter. So there's waste are taken out with a cleansing fluid called a dialysate, which is washed in and out of your belly in cycles, and she's going to explain the cycle to you.
So a soft tube called a catheter will be placed inside your belly through surgery. Then a dialysate solution will be put into your belly through this catheter. This fluid will filter waste and products that are flowing in your blood, and once the process is finished, after a long period of time, the fluid will filter out and it will flow out of your body through the catheter and then it will be discarded.
That sounds interesting.
Okay, so I just want to make sure that you have a caregiver or you're able to take care of yourself, because this does require having to do some stuff by yourself.
Right. Oh, no, that's nothing to worry about. I actually have my wife who takes really good care of me. I was just curious if there's anything I should be worried about for this treatment.
Okay.
Alrighty, I can go over those with you. So With every course of treatment, there are some risks. We're actually going to go over that right now and maybe have you sign a contract. So infection is a large risk as it can develop in the abdominal lining and at the site of the catheter that it is inserted. There may be extensive surgical scars in your abdomen, and a hernia may occur. But since you're holding your fluid in your abdomen for such a long period of time, it may strain the muscles. How do you feel about this?
It sounds a little scary, but I trust in your judgment to take care of me.
Okay.
But don't worry, there are benefits to this. You have a greater flexible lifestyle. You also have stable blood chemistry, and there's longer residual kidney function. So there are benefits to this treatment.
Mm-hmm. Does this make you feel a little bit
I
better?
feel a lot better.
That's good to hear.
So we're just gonna finish with the paperwork, and we're gonna have you discharged.
That's perfect.
So we're just gonna have you sign over here.
Sure.
So who wants to scrub it on a surgery with me?
Me?